So in this last part of the video we're going to talk about the distribution and the paths that these nerves take. So we begin with the femoral triangle. This structure here is your femoral triangle. So this is the thigh, at least here is the hip on top and the thigh begins down here. This is the medial side, this is the lateral side. Here is your muscle, gracilis. And as you can see, the femoral triangle is made up of three main structures, two of which are muscles, sartorius and adductor longus. The one above is the inguinal ligament. So the three of these make up this triangular shape, within which you find the femoral nerve, femoral artery, and femoral vein. You can use the mnemonic VAN, V-A-N, going from medial to lateral. Vein, artery, nerve. Now you can also see that there's two muscles inside the femoral triangle. The one here, which goes beneath the femoral vein and artery, is your pectineus muscle. And the one on the opposite side here, this is your iliopsoas muscle. So these muscles are underneath the nerve, artery, and vein, whereas these muscles here are on top of these three structures. So next we're going to look at the pathway that the femoral nerve takes. Now note that I've drawn the femoral nerve in red. This does not indicate an artery. Everything in red from now on indicates a nerve, just so I can distinguish it from this black colored outline. So the femoral nerve, which begins in the femoral triangle, is going to continue downward within the thigh, turn medially, cross the knee area along the back, and then come back forward and travel downward on the medial side of the leg and then into the foot, traveling anterior to the medial malleolus. Anterior. So as you can see, once it has reached the leg, the femoral nerve is now called the saphenous nerve. And we've said previously that the saphenous nerve innervates the medial aspect of the leg and foot, and as you can see, that's exactly where the saphenous nerve is located. These two structures here are the superior and inferior extensor retinaculum. You can also find the extensor retinaculum within the wrist, but here you have two of them, superior and inferior. So next we're going to look at the sciatic nerve. The sciatic nerve emerges from below the piriformis muscle, as I've said in the previous video, and then it continues downward along the posterior side of the thigh, and when it makes its way into the popliteal region, it is going to divide into its tibial nerve and common peroneal nerve, which are the two nerves that make up the sciatic nerve. The tibial nerve continues downward into the leg, running along the posterior side of the leg, and then once it gets into the ankle, it's going to turn medially and travel on the medial side of the foot. Whereas the common peroneal nerve, within the popliteal area, it's going to turn laterally and wrap around the neck of the fibula, which I'll show you in a different diagram. The tibial nerve, which we said is here, gives off a major cutaneous nerve called the sural nerve here, which I've said previously innervates the lateral aspect of the leg and foot. The common peroneal nerve, before it reaches the neck of the fibula, is also going to give off a branch, and this branch here is called the sural communicating branch, which I've said previously simply joins the common peroneal nerve to the sural nerve of the tibial nerve. The common peroneal nerve, as it travels laterally and wraps around the neck of the fibula, is going to continue on the anterior side of the leg, giving off two main branches, the deep peroneal nerve and the superficial peroneal nerve. The deep peroneal nerve runs deep within the muscles and travels underneath the superior and inferior extensor retinaculi, making its way into the foot, where it will give off a cutaneous branch that will innervate the skin between the first and second toe. The superficial peroneal nerve, as its name says, runs superficially, close to the surface, and as you can see, it travels not underneath, but above the superior and inferior extensor retinaculi, ultimately giving rise to branches, cutaneous branches that will innervate the entire dorsum of the foot. So next we're looking at the tibial nerve. The tibial nerve, traveling downward, turns medially. And this point here, the point where it turns medially, behind the medial malleolus, is shown in this diagram here. So this is the point, this turn right here, along the posterior side of the medial malleolus. This one point here is shown here. So as you can see, when it does make the turn, it's going to give off three main branches. This one here, the medial calcaneal nerve, which is going to go on and innervate the heel of the foot. And then it's also going to give off two more branches. The one more anterior is the medial plantar nerve, and the one more posterior is the lateral plantar nerve. And this nerve here is the saphenous nerve, which I've shown up here when I was talking about the femoral nerve becoming the saphenous nerve and running along the medial side of the leg and foot and traveling anterior to the medial malleolus. So the saphenous nerve travels anterior to the medial malleolus, the tibial nerve posterior to the medial malleolus. So finally, if we follow the medial plantar nerve, lateral plantar nerve, and the medial calcaneal nerve into the sole of the foot, we would see something like this, where you have here is the medial and lateral plantar nerves, and this is the medial calcaneal nerve. As you can see, the medial calcaneal nerve innervates the area of the heel, which from previous video I've said that has a cutaneous branch that will innervate this area here. The lateral plantar nerve innervates the lateral 1/3 of the sole of the foot, and its cutaneous distribution is shown here. And finally, the medial plantar nerve innervates the medial 2/3 of the sole of the foot, shown here.